Malene Hallund is an oral maxillofacial surgeon from Copenhagen, Denmark, but she received parts of her training in South Africa.
What I did there was I was trained to do traumatology, and I was treating these patients that had unfortunately been victims of gunshots or vehicle accidents. So doing the major surgery down there was a big part of my training. Today I'm working more in oral surgery, so I'm using more the finer art in surgery than the major trauma cases.
Today, she runs a clinic for advanced dentistry, oral surgery, and implants, together with her partners in Copenhagen. She is chairman of the Danish Association of Oral and Maxillofacial Surgeons and teaches surgery and implantology at the University of Copenhagen.
In my spare time, I love to spend time with my two children, using all my energy on them because we work very hard every day. And I think if I have to do something really nice for myself, just get some fresh air and some action and just kind of recharge my batteries, I think it's the horseback riding that is really important to me.
Please give a warm welcome to Malene Hallund.
Well, thank you very much. My children asked me if this was a stand-in on the horse, and I had to convince them that it was not. I've been looking very much forward to this afternoon, to be here with Dentsply Sirona and you, Charlotte, and Martin and Lyndon, and also to be here with you, to be able to share with you some of my thoughts about what we can do for our patients, how we can make a difference, and to share with you some of the newest technology from Dentsply Sirona, the Zento. I've been sitting in conferences in audience like this so many years, listening to colleagues presenting their research and listening to people inspiring me and showing the newest treatment modalities. So if you are just a little bit like me, now listening to Lyndon about the evolution and Martin about the newest technology, you now have three choices. The first choice is, this is too complicated, it's never going to happen. You're going to go on Facebook, you're going to now text an old friend, and when you come home, nothing new is going to happen in your practice. Or you can take the second solution, which is, this is interesting, this is what I want. I want to do exactly like Martin, and I want to implement it in my practice. But when you come home, the speed of life and your busy schedule is going to put you in a situation where you're never going to implement it. I think today we should take the third option, which is actually listening, learning, getting inspired, and then go home, spend the time and the energy to actually implement it in our practice so that we can make a difference, not only for ourselves, but for our patients. Today, there has been spent thousands of hours and hundreds of articles explaining to us how the osteoblasts work, explaining how the osteoclasts work, and how we get the best osseointegration for our implants. And I think that puts us in a unique situation, because if we use the research from the past and the newest technology of the future, and we merge those two things together, we are actually in a situation where we are able to provide our patients with dental implant treatment that is evidence-based and with the best and newest solution. So we can actually help our patients that lose their teeth. And losing our teeth, or patients losing their teeth, is one of the worst things that can happen. When we dream about losing our teeth, it's associated with the fear of losing strength, the fear of losing control, and losing health. And all that together is also about social status and about self-esteem. I would like to share with you one of my patients, Jens. He came to our practice with a dentition like this. His biggest problem was actually not the way the teeth were healthy and unhealthy, and it was not the fact that they were actually loose. The major problem for Jens was the way the teeth made him look, his smile. because this is what he looked like when he looked in the mirror. And this is not the person Jens sees himself as. This is the person Jens sees himself as. It's two different people. And this is the reason why he didn't show up to his high school reunion, because he didn't want to show them that this is what he looked like today. So his self-esteem was somewhere very different from where it's supposed to be. And that's where we as dentists can come in and help our patients. We have many of these patients in our practice, and many of them we can help with a better and more beautiful dentition. But it's not all about self-esteem and beauty. It's about health. We know from the literature today and the recently published articles that there is a correlation between the periodontal disease and our systemic disorders. So by reducing the low-grade inflammation of these patients, we're not only improving the oral health of our patients, but we're also improving the overall health for our patients, which is very important for us as dentists. I would like to introduce this patient to you. This is a patient of mine that came to our office. He looked like this, and he was very concerned. He wasn't too much concerned about the way his teeth looked, but he was very concerned with the fact that he knew that underneath these bridges were teeth that was very unhealthy and wouldn't last. He was diagnosed with severe peri-implantitis and severe periodontitis. And the problem for my patient Jesper here was that he was a professional saxophone player. And if you are that, your oral cavity and your teeth is a part of your instrument. And if you're afraid of losing your teeth, you'll be afraid of being able to perform on stage, and you will be afraid to be able to be who you are as a professional and to keep your self-image.
I always like eating apples, you know. So I realized that when I bite the apple, it hurt. I said, that's wrong. So I went to my dentist and said, they're loose. There's not much bone left. So you have to do something about it now. We cannot repair it anymore or fix it up.
Jesper Thieleau is a fantastic jazz musician, and he's internationally known for his saxophone. He has played stages many places in the world, but he came to a part in his life where he was getting insecure about what he could perform because his dentition was falling apart. So I think for Jesper, the risk of losing his tone in the music would be part of him losing a part of his personality. So we have to help Jesper. We have to make sure that we can help him stay the saxophonist player and help him with his oral health and his systemic health, because he was suffering, as I wrote, from type 2 diabetics as well. We decided in this case to help him with the Smart Fix solution, because other dentists have offered him removable dentures, but you cannot play a music instrument like that with removable dentures. So we had to find a solution that gave him the fixed bridges in the upper and lower jaw. So with the Smart Fix concept, we could make sure that Jesper didn't leave the office without teeth, and that he surely and quickly could be able to play his music instrument again. And I know for a fact that it has made a big difference for Jesper in his life. I would like to introduce you to the last part of my talk today, and that is about individualizing ourselves, because that's what happens today. Everything is being individualized, everything is being custom-made, people are even custom-making their self-image, the way they look. And I think that thought about changing and customizing things goes very much in line with the newest treatment solution from Dentsply Sirona with the Zento. Because here we are getting an individualized implant treatment solution that, because it's custom-made to each of our patients, it gives us the convenience of everything in one box, and it gives us opportunity to treat our patient that is very time-saving, and I will show you how. Everything comes in a box. In this box, we have the drills we need for the treatment. we have the implant we have chosen, we have the surgical safe guide that helps us to do the fully guided treatment, and we have the option of choosing the Atlantis healing abutment and also the Atlantis temporary restoration. So using the workflow that Martin introduced us to, we have a short and easy workflow. We can do our scan, we can approve our case, and we can do our treatment. And all that is done in 1 week. So from the day that we are actually uploading our data, within 1 week, we get the box and we can do the surgery. In our clinic, we've done several cases, and we've done these single tooth replacements. Some of them have been simple cases, straightforward. Some of them have been more complex with some bone augmentation, and some has been advanced with immediate placement. And I would like to share this case with you. This is a 37-year-old lady. She came with a fractured upper 5, and she would like to have an implant done as quick as possible. So we can see now that there's no pathology around the tooth, and we could actually provide her with an immediate implant case. We're a little bit close to the sinus, so I have to make sure that this treatment is done very precise, so that I am sure that I get my primary stability, and also making sure that my osteotomy does not go into the sinus. And here I can use the Zento and the pre-treatment plan. Clinically, we can see that there's enough bone, there's enough soft tissue, and we have enough room between the adjacent teeth and also an acceptable area to work in. As Martin just showed us, we take the intraoral scan and we take the CBCT scan. And merging those two files together after uploading them, then Simplant is ready and can give us a treatment solution. A treatment option, sorry, a treatment plan. So after about 24 hours, I get this treatment plan from Simplant, and there I can look at the implant that is planned. I can see if I like the place, I can see if I like the inclination of the implant, and I can also check if I like the distance to the neighboring teeth and if I'm happy about how deep the implant is being placed. And if not, I can just modify it, and afterwards I can approve it. When I approve it, I also make the choice if I would like to use the opportunity of ordering a customized healing abutment that will support my soft tissue already from the day of surgery, or I can also choose to use the Atlantis abutment and put a provisional crown at the day of surgery or maybe later. And then I wait 5 days. And then comes the box. And it's not a box like in Forrest Gump where you never know what you're going to get. In this box, we actually know what we're going to get. It's going to be the implant we planned for. It's going to be the drills that goes exactly to this treatment plan. And we're going to have also our surgical guide. In this case with Bodil, I of course had to remove the fractured tooth first. And then I could place my guide, and it fits very, very precise and very nicely in all of the cases. And then using my drills with my sleeves, making sure that I only do my osteotomy exactly where I'm planning it, and then making the possibility of placing my implant as we have plans. On the implant driver, there's a little groove, and on my surgical guide, there's also a groove. And once those two are aligned and in the correct position, I know that my implant is now in the place that we planned for pre-surgically. And in this case, I was doing the immediate case. So after placing my implant, I did my augmentation with my xenograft. I could remove my cover screw so they wouldn't get anything in the implant, and then place my customized healing abutment supporting my soft tissue at the day of surgery. So with the Zento, we have a short working flow. We are able to provide our patient with an implant that is in the correct position, and it's crown down planned. And in this case, we could 4 months later place a temporary final crown with an acceptable aesthetic outcome. So the day of surgery, placing the implant in the correct position, and then 16 weeks later, providing with the surgical, with the final crown. Another case would be this one. This is more straightforward case. It's a flapless case, so we can just make a punch and place our implant. We don't have to open up and look, because we actually looked at the CBCT scan. We planned it. We planned the osteotomy. We planned the implant placement. And then in this case, we could use the provisional crown and give the patient a tooth at the day of surgery. So with the Zento, we're able to do a single tooth replacement in advanced, simple, or a little bit more complex cases. And I think in summary, I would say that the Zento gives us the customized implant treatment solution that is convenient for the patient and for us as dentists, and is also time saving for all of us. And looking at the patient and what we can do for them, I think the combination of the knowledge from the past and the technology of the future together gives us the opportunity to help our patient in the best possible way. With that, I would like to thank you very much.
Terrific. Come sit and join us.
Thank you very much, Malene.
Thank you.
Malene, that was just terrific.
Thank you.
Your practice is beautiful, your work is outstanding, and your insights are really very important to us. I want to talk about Zento. What did you think when they brought this box to you?
Well, I was actually amazed that I only a week after my upload of my days, I got this box in my office. And then I was actually very surprised by my staff, how happy they were, because they didn't have to order all these extra things. And then I didn't have to think too much about what I needed, because everything was in the box. So I was pretty surprised.
So you've got to communicate in your office, right? And in addition to all the parts, aren't all of your thoughts about the case right in the box?
I'm sorry, say it again?
All of your thoughts about the case, are they in the box too?
Well, if I understand the question correct, I think most of my thoughts about the operation I've been able to do before when I was planning it. Yeah. So I didn't have to be too nervous about going into the surgery. So it was a really relaxed surgery.
It is.
And for me as a surgeon and for my assistant, so that way it's much less stressful, and the timing of the surgery was also much less. Yeah.
You showed one case where you have an immediate provisionalization and many healing abutments, and we've talked about the rarity of that perfect immediate loading case earlier today, but when you grabbed that abutment and you screwed it in place, were you excited that it fit?
I was excited because it fit perfectly
Absolutely.
at the position. As long as we place the implant in exactly where the guide is telling us to do it, it fits perfectly, and the contact points also. So I was a little bit surprised, I must say.
Well, thanks again for a wonderful talk.
Okay,
Thank you very much.
We have some questions from the audience
Yeah.
about the, I think it could go for any of you actually. It is, how do you see the future surgical treatment in the aesthetic zone?
The future. Go ahead.
Well, I think being able to provide immediate provisionals and being able to do them in a workflow that's convenient is always going to be the gold standard in the aesthetic zone. So having something that will allow you to predictably know when the implant is in, where your abutment is going to be, and also how the tissue will behave over a period of time is still the future. When we're still searching for that on every case, I don't know about the two of you. I don't know how you would answer that.
I might disagree a little bit. I don't think, I don't think immediate is the solution for every patient. But I will say that our research and our experiences teaching dentistry in a dental school for many students doing these anterior restorations is the lesson that tenths of millimeters mean something in terms of aesthetics. So I actually think the future of anterior aesthetic implant dentistry is about guided surgery. You can make it simple with a pilot guide, or you can use full guidance, but whether it's a single tooth or 6 anterior teeth being restored, I think guided surgery has so many benefits, whether it's immediately loaded or it's provisionalized or it's staged. I see the value of that, and as an experienced clinician, I've just rallied around that guide in the last 2 years. Malene?
Well, I think being part of the education of implantology at the University of Copenhagen, I agree with you that the future will be the fully guided as well, but I think it's important that we make sure that the dentists and the students learn to work not guided to begin with, to learn the basic skills, and then from there move on. Otherwise, we're going to have...
When you can't use the guide.
That's right.
But I think the planning really comes into this, really, because in the future, if you can plan to have everything there and ready, that's going to be the key.
And isn't that the brilliance of a Zento? You don't get the box unless you do all the planning, right?
You have to prepare.
And you have to prepare.
Yeah.